Hi, I'm Dr. David Hill, and today we're going to talk about how to cure acid reflux in infants with baking soda. And I have to say I'm laughing a little bit because I just wouldn't. I just would not recommend trying to cure acid reflux in babies with baking soda. Why is that? Well, baking soda is a very simple form of a chemical that we call a base. And the idea behind this is when you add a base to an acid, it neutralizes the acid. However, if you've ever done a baking soda volcano, you know what happens when you put baking soda into vinegar. You generate a huge amount of excess gas, right? That's what makes the volcano erupt. So I'm not sure it would be a really good idea to try and give your baby a baking soda solution to try and cure acid reflux. That said, acid reflux is a significant problem for a lot of infants, and there are some good medicines that we use to try and make that better. Now, before you even get to medicines, there are some alterations in feeding you can use. If you're breastfeeding, you can try nursing a little bit more frequently and lower volume to get the same amount of food in the baby without filling his or her stomach up so much. If you're using formula to feed, you can thicken the formula with rice cereal, using 1 level teaspoon of rice cereal for every ounce of formula. The idea here is that the formula will be more calorically dense, and you can then give a bit less, maybe an ounce less per feed, while still getting the same number of calories into the baby. You also might want to try and keep your baby semi-upright after feeds for about 30 minutes. Don't push on the belly, don't put him or her in a swing. Some simple things so that you don't push gastric contents up into the esophagus. Now, there are 2 classes of medications that are also effective for acid reflux in babies. One are called type 2 antihistamines. The most familiar of these is ranitidine or Zantac. Some people will also use Pepsid. Another class of medications that seems to be a bit more effective is the proton pump inhibitors, or H1 blockers, as doctors will call them. The most common among these is omeprazole, Prilosec. You can get this as a liquid suspension from some compounding pharmacists. We also use lansoprazole, Prevacid, that comes as a dissolving tablet, which you can mix up with a teaspoon of water and give to your baby that way. So if you're concerned about acid reflux in your baby, before you go reaching for the Arm & Hammer, I would strongly counsel you to talk to your doctor about medications or non-medical therapies that might be used to help your baby with reflux. Talking about treating reflux in babies, I'm Dr. David Hill.